I'm looking in the EHR and I have a patient, Jerry Batch. He's a male, birth date 6/16/19XX. He is allergic to iodine. Looking in his orders, I have an order to discontinue his indwelling urinary catheter. Doesn't say in here, but I would look for the reason he had one and how long he had it. I'm going to gather my supplies for this. So I already have a hazmat bag or red bag in the patient's room, so I don't need to gather that. I'm going to do pericare, so I'll grab that. Empty his catheter bag and this. And I think that's all I need. Knock, knock.
Hello.
Hi, my name is Lainey. I'm going to be your student nurse.
Hi.
Can I move your table?
Yeah.
Okay. So first I'm on a hand hygiene. Make sure his bed is locked. Provide privacy. Alright. Could you verify for me your name and date of birth?
Yeah, it's Jerry Patch, 6/16XX.
Okay, and Mr. Batch, do you have any allergies?
I do iodine.
Okay, I see that on there. Alright, so I am here because I'm going to be removing your urinary catheter. Have you been having any issues with it?
No.
Okay, have you noticed any abdominal pain, any burning, anything like that?
Nope.
Okay. Are you in any pain right now?
I'm not.
Okay. So before I can discontinue it, I'm going to first do a skin and GU assessment, empty your bag, and do some pericare.
Okay.
Okay, is it going to be okay if I expose you?
Yes.
All right. Okay. All right, for the assessment, first I'm just going to inspect, looking for any swelling, lesions, skin breakdown, any rubbing from the tube, irritations, anything that I see. Is it okay if I palpate a little bit?
Mm-hmm.
Let me know if there's any tenderness.
All good.
Okay, so I would just note any abnormal findings that I discover. Okay, so I'm going to cover you back up and I'm going to empty your catheter bag.
Okay.
And a paper towel. Make sure I got all the urine out of the line. Okay. Alright, put this in the laundry. I'm going to take this to his bathroom. He's still in the patient's room, just in his bathroom. Sign this on a flat surface. I'm going to note that I have 150 milliliters, noting the color, clarity, and any odors. This is his toilet. I would put this in the toilet, rinse, put this where it belongs. And then I'm going to remove my gloves and hand hygiene again. Okay, so when I take this out, it should be relatively painless. I'm just going to have you take a deep breath, and on exhale, I will remove your catheter, okay?
Okay.
And I need my syringe to deflate the bulb. I'm just going to expose you a little bit.
Okay.
Okay. I'm going to remove the adhesive. Making sure there's no skin breakdown or irritation from this. I'm going to have my red bag ready. deflate the bulb. Okay, I think the bulb's deflated. All right. Can you take a deep breath and exhale? Pulling out smoothly. All right, before I dispose of this, I'm gonna make sure that it's intact, not missing any parts, noting any blood, mucus, or any discharge on the tubing. Then I am going to take these and put them in my red bag or dispose of them per facility policy. Dispose of my gloves, hand hygiene. All right, I'm just gonna clean you up a little bit.
Okay.
And then we should be done. It looks like your chuck is a little wet, so I will come back here shortly and place a new chuck under you.
Okay.
Just clean. Always check in for any mucus, skin breakdown, anything abnormal. All right, so I'm gonna put this in my laundry, wash this, put this away, dispose of my gloves, hand hygiene again. All right, I'm gonna cover you back up.
Okay.
Again, I'll be back here shortly to change that chuck. If you could please let us know when you use the restroom, that way we can make sure that you're still able to urinate freely on your own, and if you are having pain, discomfort, any discharge like that, if you could please let us know.
Okay.
Okay, I'm gonna give you your call light and lower your bed. Make sure the bed's locked. I'm gonna give you your personal belongings. And then I'm gonna clean up my area. All right, so if you need anything else, please don't hesitate to let us know.
Okay.